Welcome to Brain Matters. Tonight, our topic is Every Step Counts, moving away from dementia. Here is a quick overview of our agenda. Please note that there will be a Q&A period, so you may want to grab a pencil and paper to jot down questions as they come to you during our guest speaker's presentation. You may also put them in the Q&A box. My name is Tony Teano. I will be your host for this webinar. I work with the Johns Hopkins Alzheimer's Disease Research Center. Joining me on the webinar team is my colleague, Dr. Corinne Pettigrew, also with the Johns Hopkins Alzheimer's Disease Research Center, who will monitor the chat box during the webinar, as well as the Q&A box when we get to that point. Additionally, we are delighted that longtime community health advocate, Mrs. JoAnn Scipio, is with us tonight. Mrs. Scipio represents the Caucus of African American Leaders of Anne Arundel County, a stakeholder on the Brain Matters Steering Committee. She will have a brief discussion with our guest speaker leading into the Q&A period with you. After that, I will return for a few announcements before the event ends. At this point, we'd like to know how you heard about the webinar. You should see a poll on the screen at this juncture. We'll give you a moment to complete it. Now it is my pleasure to turn the program over to Mrs. JoAnn Scipio, who will introduce our guest speaker.
Thank you, Tony. We're very happy to have with us tonight Dr. Amal Wanigatunga, who is an assistant professor of epidemiology at the Johns Hopkins Bloomberg School of Public Health. He completed his graduate training at the University of Florida, earning an MPH and a PhD in epidemiology and a certificate in gerontology. In 2017, he joined the Bloomberg School of Public Health as a postdoctoral fellow, with the epidemiology and biostatistics of aging training program. And he became faculty in 2019. Dr. Wanigatunga is affiliated with the Johns Hopkins Center on Aging and Health, as well as the Johns Hopkins Alzheimer's Disease Resource Center for Minority Aging Research. And he conducts research with the Johns Hopkins University Engage Lab, which is focused on energy, activity, and aging. His research broadly focuses on all things related to physical activity and aging, with a focus on exercise as medicine. He has particular expertise working with research and commercial grade wearables. He is currently the PI of a trial aimed to identify and reduce at-home sedentary time as a means of starting and maintaining a more active lifestyle. Dr. Wanigatunga's research was recently featured online at the Bloomberg School of Public Health in a story titled, "Small Amounts of Moderate to Vigorous Physical Activity Are Associated with Big Reductions in Dementia Risk." Among other findings, the story reported even frail older adults may benefit from a little exercise, and engaging in as little as 35 minutes of moderate to vigorous physical activity per week compared to 0 minutes per week was associated with a 41% lower risk of developing dementia over an average 4-year follow-up period. Without further ado, I am delighted to introduce Dr. Wanigatunga. We are thrilled to learn more about your research on this topic.
Okay, thank you so much for that introduction. I just want to make sure everyone can hear me and my slides are being shared right now.
You are all good.
Okay. Well, thank you, JoAnn, for that wonderful introduction. I often introduce myself as an epidemiologist, a gerontologist. I joke that, I study aging, which affects everybody. I study physical activity, in which, if we're alive, we're moving, we're out and about, and everyone engages in. So that lends itself to me being able to study practically anything that I want. But one of the most robust arms of my research is connecting brain health with physical activity. Not just that physical activity can improve it, but then also as physical activity as a vital sign, right? And it might be able to tell us something about our brains and our cognition as well. Okay, so let me start off with make sure my slides are moving. Here we go. Disclosures. Nothing really relevant to this talk, but I've had an honorarium from the Villages. That's a big retirement community in Florida. The overview of this talk, I'd like to start out by defining what physical activity is, reviewing our federally recommended guidelines for engaging in physical activity, and highlighting its related benefits on our health. And then I would like to talk about how that relates to cognition, to brain health, dementia risk, and specifically what JoAnn was talking about, our recent paper, and then think about and discuss ways we can become more physically active. Okay, so let's define physical activity. There's many different definitions of physical activity. We commonly use the one from the World Health Organization, and I'll just read it right here. It says, any bodily movement produced by skeletal muscles that requires energy expenditure. Now, the reason why we define it is because there are terms of physical activity that get interchanged with other terms. Like, for example, exercise, right? Exercise is a subset of physical activity that is planned and purposeful for health benefit. So when you hear me talk about physical activity, I'm talking about anything. Going from this room to another room, reaching for the remote when I'm watching TV, that's a form of physical activity. Whereas exercise this is meant for me and my health. The other term that kind of gets interchanged with physical activity is physical function, where physical function is the ability to perform physical activity. So sometimes in research, you'll see people measuring gait speed, and that's just looking at their physical function, their ability to walk. And that can predict many health outcomes, including dementia. Also, when we're talking about physical activity, it's good to note what are the dimensions of physical activity. These become important when we're defining what is recommended for daily life. So the first dimension is frequency. I think that's pretty easy to understand as how many times per week are you physically active, right? The next dimension is duration. So when I'm active, how long am I active for? How long is that session? Intensity, when I say physical activity intensity, what I mean is how much effort is given, right? So if I'm walking upstairs and I'm huffing and puffing, that's an intense physical activity. And then there's type. Type means many different things, right? So when I'm active, what am I doing to be active, right? Is it aerobic? Is it strength training? Is it lifting weights? Is it balance? Is it stretching? Is it stretching? Okay. So it's using these dimensions that we have what these guidelines for being physical activity for the US population. And here I'm putting a screenshot of what these guidelines are. And let's just go through it. This is the second edition. This was published in 2018. They publish this every 10 years. So we're coming up on the next one, 2028. But this was a very interesting one. So they define it as moderate intensity aerobic activity, right? Moderate intensity is the intensity, aerobic is the type. You see at least 150 minutes, that's the duration, and the frequency is per week, right? And they have all sorts of things. Anything that gets your heart beating faster counts. Break it up over the whole week as you want. So commonly you'll hear people say just do 30 minutes per day for at least 5 days a week. And there's another portion of this, the muscle strengthening. So the muscle strengthening is another type of physical activity, and they just say do it twice per week. I think this often gets forgotten about, but there's a lot of research on muscle and brain health now that's coming out, and this is being better defined with newer and newer research. Okay, I really like this slide because the point of this figure and this graph is to say that everyone can benefit from physical activity. So let me walk you through the figure. On the x-axis here, if you can see my mouse, that's physical function. Remember, the ability to perform physical activity. And when we're young, we're not living with disease or any type of pain or aches, we have high functioning, right? So if we engage in physical activity, this top line, we can maintain our function as we age or as we are living with more disability or disease. But what we can see is if you see where it says begin physical activity, and if you start it at different stages of disability, you can still maintain what you have, right? So this is for physical function. If someone's preclinically disabled and you start to intervene or introduce physical activity, you can slow down the declines. You can't return back to normal in most cases, but you can still keep what you have, right? And you can even do that in a disabled state as well. But now there's a big growing body of evidence that's linking this to cognitive function. So if you can start early, you can try to slow down cognitive declines earlier and maintain cognitive function, but you can still intervene at different stages of life. Another aspect of this is that any amount of physical activity counts. I think when people hear that, oh, I need 30 minutes per day, if I do 20, I didn't get the benefit. No, that's not correct. So I think this figure nicely illustrates that. And this is in relation to mortality, or think about it as longevity, right? So if you look on the y-axis, this is the hazard rate of mortality. If I did no physical activity all the way to the left, I'm at a 1. I'm at this dot at the far left. But if I start to increase my physical activity, I'm reducing my risk of mortality from, oh, I'm sorry, from going from, it's called leisure time or med hours per week. If I increase my med hours per week, there's a steep early slope or a drastic reduction in mortality risk. And then it continues to go down when you increase. And then when you get to about 8.25 METs, which is around 150 minutes per week, you see you get most of the benefit around there. And that's why the guidelines are there. They're around the optimal dose of physical activity. Because if you start to increase activity beyond that, you get a little bit, almost negligible benefit from increasing for health. And then there's more studies out there that show that it's kind of the same curve if you look at cardiovascular disease, if you look at diabetes, if you look at cancer, all sorts of health outcomes as well. So what are these benefits? I'll just quickly review, and these are in the 2018 guidelines as well, but essentially there's longevity, right? Lower risk of mortality, lower risk of the leading causes of death from chronic disease, cancers, improved reductions in weight gain. There's actually a mental health component to it. And then improved bone health, physical function. What was new to the 2018 guidelines, what I was back calculating just like moments ago, which is almost like 7 years or 8 years now. They're going to update it very soon. But back then, what was new to these guidelines was they introduced that engaging in the recommended levels of physical activity also reduced dementia risk, right? And improved cognition. So now you have all of these benefits that I'm circling here around mental health and brain health as well. So let's talk about brain health a little bit. So the brain is not immune to aging, right? So what happens just in a very simple manner is that with aging, the brain deteriorates, right? It kind of shrinks, some small holes form. Someone has described it as it's becoming like Swiss cheese. I don't know if that sounds dramatic, but you know, it's shrinking. And with these shrinkings, if they're happening faster than what we would think is normal aging, that is related to increased risks of cognitive deficits and then increased risk of dementia and those types of disorders as well, right? So just like physical activity, brain health has all sorts of dimensions to it, right? The structure of the brain, how the brain functions, no matter what the structure is, mental health, quality of life, cognition, and then the diseases or the syndromes that affect it. But then there's this just enormous body of literature that it just keeps growing of epidemiologic evidence showing that physical activity seems to be associated with improvements in all of these aspects as well. Okay, so what exactly are these improvements that we may see? We can kind of bend them into immediate versus long term. And there's a lot of research that shows there's an immediate effect. Like if I do some exercise right now, right after, there's an association with reduced anxiety. There's an association with improved sleep and improved cognition. And then, of course, there are these long-term effects, right? The immediate effects turn into long-term effects as well, but then you also have the reductions in depression and risk of dementia, better sleep and deep sleep as well. And these are just highlighting kind of most of the major evidence that has the most quality to it. There's even more to this as well that is coming out. But yes, so the mechanisms in which physical activity actually affect the brain, there are theories out there, but it's still being explored and researched. But on the next slide, I believe, yeah, I wanted to review kind of what people are thinking, how physical activity affects the brain. So I think, most people will say it's through this idea of blood flow, right? So if we remember, blood carries oxygen, it carries nutrients that are important, and the brain needs this blood and needs this nutrition and oxygen. So if you're exercising, it improves regulation of blood. The brain has very, very sophisticated and complex areas that have very small capillaries that can get easily blocked, or it's hard for blood to get in, but the physical activity is thought to improve blood flow into those very sensitive areas and maintain higher order cognition. The other way that I think is gaining more steam, the other theory, is through muscle contraction. Now, the muscle, when it contracts, actually secretes a lot of good stuff, a lot of good hormones, a lot of good proteins, some of which the brain actually uses. So if I'm walking and I'm contracting my largest muscle groups, which are in my thighs, the quadriceps, right? That is thought to then circulate up into the brain, even cross what's called the blood-brain barrier, and then go into the brain and help with things like neurogenesis, like actually creating new brain cells, neurotransmission, brain cells talking to each other, neuroplasticity, all sorts of things, right? So that's kind of the theory, and that's why I think resistance training is now starting to get more focus and things like that. But still, aerobic activity in the blood flow is kind of the main theory here. Okay, now, despite all of this evidence, I think I have not met somebody who does not know physical activity or exercise is good for them. But here on this graph, what I'm showing is in the US for older adults, this was published in when maybe 2016 or 17, but still even updated data show that if you look on the y-axis, that's the percent meeting the guidelines or saying that they meet the guidelines, no bar crosses above 50%. So over half of our US older adults still do not meet the guidelines or say that they are. And then each kind of row, like the first three columns represent older ages. And with older age groups, you can see the prevalence getting lower. And then for muscle strengthening, which has very poor guidance on how to meet those recommendations, have the lowest prevalence of all of it. So still there's not great engagement in meeting these guidelines. And that kind of goes to the aspect of, well, and our thoughts in our research group of like, well, then what's the minimum we need to at least get started to build towards becoming more active? I think, when we're thinking of the common barriers, there's a lot. I pulled some of these from the CDC, the American Heart Association. I think the biggest one is this perception of lack of time, motivation, even this perceived lack of energy or actual lack of energy, fear of falling, injury. All of these can play a role. It's very individualized. It's very personal of like what may drive someone to not engage or not feel like they have time to engage. So I think, and I think a lot of other people think, that we have a lot of evidence linking exercise to brain health, but now how do we get towards, let's start with something rather than trying to always reach the optimal dose? Maybe something or anything counts in that regard. Now, there was a recent study um, done in a sample of participants living in the United Kingdom. They have a really nice data set there, a really large sample, and they had these wearables that can collect and extract how much people were walking. Here in this paper, they used that type of data, and they related it to dementia. And what they showed was, and I have these pretty figures here, but what they summarized was that about 4,000 to almost 10,000 steps was needed to reduce dementia risk, right? So that's approximately 2 to 5 miles of walking per day. But with this study and a lot of the other studies, they tend to focus on the optimal dose. They say, what's the best? What's the most bang for your buck to reduce your dementia risk? And what we wanted to look at was, well, what is the least amount you can do as so we can overcome some of our own personal barriers into engaging more, going from zero to something, right? And I think that's particularly important for older adults who are definitely wanting to become more active, but they even face even more barriers. And I think a really nice model of aging and accelerated aging is this idea of frailty, right? People who are living longer, but you can kind of observe them. They look like that if you touch them, they'll just break, right? But we have ways in research and clinical practice to measure this, right? So we conceptualize frailty as this elevated vulnerability to poor health outcomes. It has been associated with a ton of adverse health outcomes, fall risk, cardiovascular complications, and then also more recently, cognitive impairment and increased dementia risk. Um, but there are studies that show that exercise does improve frailty management and actually reduce the risk of frailty, along with dementia, of course. But exercise is not commonly prescribed to them, right? There's these ideas of ageism, like this person is too old, they shouldn't be walking, maybe they'll fall, or things like that, even though the evidence says the opposite. Exercise is good. So when I look at these studies, they commonly leave out the older adults. They look at optimal dose and they look at younger populations. So that's kind of what led to this idea of, well, what's the lowest amount of moderate to vigorous physical activity that would likely reduce dementia risk, particularly among our frail older adults who we don't want to leave behind. They're still interested in their cognition and keeping it. So this is a figure from that paper that we published and that JoAnn mentioned. And essentially, what this is showing are a couple of lines. The top line is showing what someone's dementia risk is over time if they did not exercise. If you can see my mouse here, that's these people. They're not engaging in any exercise. And then the bottom lines are showing that incidence of dementia reduces, right? That's why the lines are below here. If you increase exercise in a graded manner, right? These are actually, the lower the lines, the more exercise. So you can actually reduce the risk of dementia with more exercise. But to me, I was very interested in what is very little exercise compared to zero exercise. And what we found was going from 0 to 1 to 35 minutes per week, which is about 5 minutes per day, there was a 41% lower risk of dementia, which I think is great that we actually quantified this. This gives us evidence to say, just do something, it will help your brain health. Or there's this possibility that it will. Now, this is not a trial. This is a big study. This was in almost 90,000 people. But it gives us that evidence to continue and look at look at novel ways for activity promotion and different ways we can promote activity. I think the second piece, I had a lot of interviews about this paper, but I think the second piece was flying under the radar. And what we found was these results actually persisted if I looked at people who were frail and who were pre-frail as well. In our study, we saw people who are pre-frail had about almost 50% more dementia risk than those people who are not pre-frail. And those people who were frail had about 100% more risk of dementia compared to those who were not frail. And still, we saw if you went from 0 to about 5 minutes per day, even among those people who were frail, they reduced their dementia, just like these results are showing. So it did not go away. It actually still helped them. So this is why I was introducing that anything counts and it helps everybody. Okay, I'm probably getting toward the end here, but I wanted to touch on forming physical activity habits. That paper was really towards this idea of how do we become more active when we want to be. Um, with technological advances and increased longevity. Um, I think we've kind of engineered activity out of our lifestyle. Like if I hold my phone up here, I have the internet at my fingertips. I don't have to move. I can get DoorDash. People come to me. I don't have to do anything. But like, how do we bring activity back into our lifestyles? I don't think it's as easy as just saying go to the gym. So these types of results help us think about how we form physical activity habits and having some evidence behind it. So here are some easy tips. I think a lot about just sitting less. I think we sit a lot during our day. There's a lot of studies showing we sit for hours on end. So just sitting less, standing more can be the start towards activity promotion. Starting slow, increasing physical activity gradually. I think a big one is planning. A lot of the research on motivating and for physical activity habits focuses on motivation. I think motivation is fine. I think it helps, but it's not something that will form physical activity habits. You really need a process and you need to make it easy for yourself and enjoyable for yourself. And I think that's the key towards making the physical activity habit. And then, of course, consistency is key, but being forgiving of yourself. If you don't do it one day, it's okay. You could just do it the next day. That's fine. Just the consistency is the key. And then rest and recover, physical activity. Oh, you always need rest, and you need your sleep and good nutrition as well. There's more resources I put a link down here for ACSM. I imagine these slides are being shared, but they have all sorts of resources for older adults, for people living with certain conditions, and how to tailor physical activity and really make it your own. And I wanted to highlight this book that I read last year. It's called Atomic Habits. And the author, James Clear, I mean, he was speaking my language. He was just saying like at the top, very tiny changes. Think about like adding a minute of exercise every day for the next year. You've exercised 365 minutes. If you add 10 minutes a day, that's almost 4,000 minutes. It's just tiny changes lead to remarkable results. And just starting small will always help you form these physical activity habits. Okay. So I just want to end with, oh, and here's the big takeaway. I think really, if you're going to form the habit, it should be enjoyable, spiritually uplifting, or something that just gives you some sort of purpose as well. I just want to end with that the novel interventions are coming in this regard and thinking this way. We had a recent study that we use these wearables to track, and the idea with this study was that the wearable can capture unique physical activity signatures. Remember, physical activity is everyday movement. We were trying to capture unique physical activity signatures that may be related to cognitive deficits, right? We're comparing between people with and without memory problems. We had a very interesting result. Both sets of people with MCI or not, they actually had similar physical activity patterns. And I should describe what this is. Basically, what this is someone's physical activity from 12 a.m. to 12 p.m. or 12 a.m. the next day, right? So this is time of day. People are sleeping on the left. They get up, they wake up, they go about their day, and then they ramp down right as the evening occurs, and then they go to sleep. So that's kind of their diurnal physical activity pattern. And if you break it up by people who are unimpaired versus mild cognitive impairment, what we see is some morning time differences in physical activity, which I think, and our research is showing that morning time physical activity differences is very related to cognition, not so much fatigue because you just woke up, but this organizing, this executing what you want to do in the day. If you start to see these differences, that may be a digital biomarker. So we're thinking of doing trials and talking to the community of like, what do you think this means? And would you want to intervene on it, and building an intervention around that? And then also, JoAnn mentioned that we have a trial that, I think all this information on like how to participate in this stuff will be given, but we have a trial on how to sit less, identify sedentary behavior, sit less, and become more active in a very easy manner, and something that is not exercise per se, but activity promotion. Okay, I'll end there. I have a ton of acknowledgments. A lot of people have worked on this. I've highlighted our trainees in blue. They're a big part of it. My contact info is plastered here, and I'm happy to take questions. Thank you for having me.
Thank you, Dr. Wanigatunga. Before I ask a few questions, I'd like to invite the audience to start dropping their own questions into the Q&A box. Now, Dr. Wanigatunga, just let me say that was a fabulous presentation. Your findings are amazing. If people in the audience would like to participate in your research, how can they volunteer, and what studies are enrolling?
Yeah. I think the two main ones, we have the big memory study. I'm not sure what it's actually called, but I think Tony, our host, he has the information and who to contact. But I have a sedentary reduction program that's really more based at home. So there's no need to go to a gym or a clinic or anything. You just do these things at home and see if it fits your lifestyle. And we look at different outcomes like did it reduce your anxiety? Did it reduce your pain? We take blood too and just see some of these markers of health, both physical and cognitive markers of health, and see if it improves that as well. And people can just contact me, and I think my contact info is there.
Okay. Let's look in the chat and Q&A and see if we have questions there. Corinne, do you want to do that?
Sure, thank you. Good evening, everyone. We have a couple interesting questions in the Q&A. One is related to the distinction between strength and resistance training. Could you speak to that?
Yeah. Sorry. So strength and resistance are the same thing. Basically, when I say resistance, that's just using your exercise is just like using muscle contractions, like lifting weights. I think for older adults, the commonly most prescribed way to do resistance training is through body weight, either doing squats or sit to stands, or even getting into bands. If you remember, like those rubber bands, some may look green, they're more elastic, or if they get red, they become harder to work with. But that's what I'm talking about when I'm talking about strength or resistance. It's the same thing.
Great, thank you for clarifying. We have a question about actually one of the specific findings that you presented, indicating, I forget exactly which slide it was, but it showed that one of the lines, which we presume is an accelerometer measure, had 0 minutes of activity.
Yeah, you want me to bring it up or?
Sure. Yeah. And I think the question is that, does that indicate immobility, or is that a low?
Oh, what does 0 mean? Yeah. So, I'm sorry. Whoa.
No worries.
I think I leaned on it. 1 second. So that's a good question, and I went through it very quickly. But what 0 means is what we're looking at was we took this wearables and we extract, it gives us a lot of data. And we were able to use an algorithm to say, among all of this data of movement, what was exercise or what was movement that most looks like moderate to vigorous physical activity. And then from there, we could label each minute. Was this exercise or not. And basically what zero means is they were probably moving, but they didn't have enough movement to say that they had exercise levels. So it's not immobile, it's just that they weren't exercising according to the wearable.
Excellent. Thank you for clarifying. Um, Real world applications. So you mentioned earlier, hinted at the fact that we probably, a lot of us sit a lot, maybe too much. Um,
Yeah.
so thinking about what we do in our day to day, two-part question. One about standing desks during the workday and whether you think they're valuable. And then the second, as we're going around taking that break from sitting, doing laundry, mopping the floor, does this count as a form of exercise, physical activity? Yeah.
Yeah. That's a very interesting question. I think we're getting into the ideas of sedentary behavior. I didn't talk about it, but there's a body of research that says even if you go to the gym, if you sit for the rest of the day, that sitting itself is independently associated with worse health, even if you go to the gym. So this idea of sitting less is now coming on board in research and being part of our recommendations. It's not just that 150 minutes per week, but it's also sitting less. So standing desks. There has been evidence showing that standing desks does break up sitting time, and then standing at your desk is a good thing in general. I think we're all in so much sedentary time that the standing desks have shown a net positive. But I want to be very clear that sitting is actually very important in our day-to-day. Like we have to rest and recover. So standing at your desk too long can actually negatively impact your spine and some of your joints and increase joint pain. So I think, I think standing desks are great in general, but just be aware not to stand too much, or if you're starting to feel fatigue or pain, maybe you're standing too much. And the second point was about chores, right?
Yeah. Mm-hmm.
Yeah. Yeah, chores chores are interesting. I think chores there's people that think it can be as exercise or thought to be as exercise, and some people just think that's just a necessary part of our day, and then you need to exercise on top of that. I think there are some chores that you can push and think about exercise, like I'd say like gardening and going outside and doing those type of things, or morphing something like stair climbing into an exercise and making it an actual exercise. Dishwashing, it does increase your physical activity beyond sitting, but I think of that more as like that's something that you need to do. It can be exercise, but I tend to not count it as exercise. But some of them I do. So I think I'm being on the fence, but things that get you outdoors, I think, can be thought of as exercise if you're able to extend it.
Can you touch on the distinction between exercise and choosing to live an active lifestyle? And what I mean by that is, choosing
Yeah.
to take stairs or parking a little bit further away from the grocery store when you go, that sort of thing.
Yeah. I think um they often go hand in hand, but they can be distinct. And I think, like I was saying, it there's this term active couch potato, right? There's people that go to the gym like me, and then I just sit all day because of my work, right? So I tend to be this active couch potato. So I have to find ways to be more active. I don't take the elevator anymore. I go up and down the stairs. So I think there is this distinction that you can exercise, but then there's also finding ways to try to bring activity back into your lifestyle and choosing it according to what you can and can't do and what you're willing to do. But yeah, definitely like parking far away and then walking into Target or wherever is different. Yeah, for sure.
Okay, so then if you want from a question in the Q&A, and then we have another one in the chat that I want to get to, but that active lifestyle and being active, you talked about tracking this information from a research standpoint, but from a day-to-day perspective, Is there a setting or brand that you would recommend to help track activity on a day-to-day
Yeah,
basis?
I love funny question. Um, I work with a very prominent professor. Her name is Jennifer Schrack. She's our center director for Center on Aging and Health. I think when you look at our research, we're kind of the Darth Vaders of all these like Fitbits and Apple Watches and things like that. They tend to calibrate and hide what they're doing, so we don't know exactly what they're doing. But I'm becoming more a fan of them. And I think that if you find a device that you like and that fits in your lifestyle, it's okay if the data is not quite accurate, but if it helps you become more active, if it says, oh, you're getting 5,000 steps and you use it to double that to 10,000, great, use it. I think they're becoming more accessible. They're becoming more transparent what they do with your data, and they're actually now becoming more secure with your data. They're starting to become more FDA compliant and more HIPAA compliant and keeping your data as health data. So I think all of them are becoming great. I know Fitbit is really, really now kind of the target of many, many research studies and implementation into clinical practice as well. So, I haven't used a Fitbit, but the Apple Watch actually works very well too. So either or the Apple and Fitbit are kind of now my favorites at this point.
Great, thank you. We had a question about the morning variability and how that data
Oh
possibly
yeah.
indicates impending declines in cognition.
Yeah. I cruised through that. So let's go back to that. Let me share that again. This was a very interesting finding. Where do I say this kind of sensational thing? Okay. So variability is a new frontier for us in the wearables. Um, for those of you who don't know what that means, so let's say that I'm walking and I'm always walking on the same street the same way. But then one day there's a cone in my way and I have to walk around it, but I still make the walk, right? My walk has now become more variable. I've done the walk, but now there's variation in it. So the variation in what we do in everyday life can be good or bad, right? If I fall or I get hospitalized, but I bounce back, there's variation, but it shows that I'm resilient. That's good variation. Here in this case, what we think is we're capturing something that may indicate variation in our movement that may indicate impending decline in both physical activity and uh, decline in impending physical activity that relates to cognitive decline. So something early in the pathway of decline that may be related to Alzheimer's disease. That's what I mean by variability. So it's like you have two people that look the same, but if you find that this person is more variable in their everyday movement, in the morning, and that's a very important piece of this variable in the morning that may have a signal or maybe a trigger for like cognitive testing or something to see whether something's happening and we can start preventative measures or we can start something early along the process to try to delay Alzheimer's disease. So that's what we're talking about here. And I think the challenge is like, how do you even, so now we can capture it, how do you intervene on it? We're thinking of this new type of like grant proposal on like a mixed methods, like talking with community members of what we found, what they think this means, and whether they even want to intervene on it. And if we do, how do we intervene on it? How do we make it more stable, this signal more stable?
Excellent. Thank you for clarifying
Yeah.
or providing more information, I should say. I think one more question. Let's talk a little bit about recommendations for number of steps per day for optimal health and cardiovascular health and brain health. Some reports say 10K, some say half that. Your research suggests even a little vigorous physical activity can make a difference. What should we strive for?
I think it really is kind of up to the person and their ability level and what they want to achieve. In geriatrics, what gets highlighted is something called the four M's. And the M's mean something, right? What matters most, mobility, medications, mental state. And the biggest thing that's always focused on is what matters to you. So I think what I'm trying to say here in this presentation is if you just increase at a level that you can sustain, that's probably good enough. Like you can get to 10,000, that's great. Do it if you can, but if you can't, it's okay. Or do it the next day or something like that. It's just more the recommendations are there for a target, but I think the process of increasing toward it is very valuable as well.
Excellent. Thank you.
Yeah.
Okay. Dr. Wanigatunga, does physical activity need to be vigorous? You mentioned moderate to vigorous, and if it does need to be vigorous, how do you define that?
Sure. Okay. So it doesn't need to be vigorous. I think sometimes they put the vigorous guidelines to help people who are more wanting to be efficient. So like if you go to a vigorous level, you get to do less, right? I think the guidelines actually say if you do 75 minutes per week of just vigorous physical activity, you reach the same risk reduction. When we're talking maybe I should just define a little bit what moderate and vigorous. So moderate intensity is physical activity that, you're working hard enough to raise your heart rate, you breathe harder, you can still talk, but you can't sing. That's the usual guidance of what moderate is, right? Vigorous physical activity is where, you're rapidly breathing. You can't say more than a few words without taking a break. So that's vigorous. You don't need to get to a vigorous level if you don't want to. It's uncomfortable. You're sweating. Sometimes people are in pain or acute pain, or it's a tough thing to be in. So no, you don't need to be. But some examples, if you wanted to reach a vigorous state, is stair climbing. Stair climbing, it doesn't matter what age, right? You go up 5 floors, you're going to be huffing and puffing. I think for older adults, pickleball, things of those natures, like getting outdoors, you can reach a vigorous state. But no, you don't need to reach it to get a risk reduction.
Okay. Over the last few years, research has suggested a connection between physical frailty and cognitive frailty. What do we define as frailty?
Yeah, frailty. Frailty is, it came about through physician observation, right? A patient will walk through their door and they would see someone, they would be hunched over, they would be taking very short steps. It looks like they were about to break, right? So that is frailty. It has morphed into kind of two areas, right? One is phenotypic frailty. This is what we do at Hopkins, where it's like if someone has a constellation of either walking slow, they have muscle weakness, they're reporting fatigue or low physical activity. If they have like a combination of these things, they're defined as frail. There's a group in Canada that has defined it as like if you have all these problems and you start to add all these problems up, they call it the deficit model, then that can tell you if someone's frail or not. I think it's kind of this model, I think of it, of accelerated aging. Like you may be frail, you may be compared to your counterparts older, looking older than your counterparts. So um, that's how we kind of think of frailty. We think of it as like someone who's at even additional risk for adverse health outcomes.
Okay. Can the physical activity stave for someone with cognitive decline? Can the physical activity kind of like stave it off for further declining, or just kind of keep them where they are?
Yeah, yeah. So in what I was talking about, we're talking about like prevention, things of that nature, but there are studies that are showing it helps with management too, right? So engaging in physical activity, the thought of the blood flow, the muscle contraction, but also there's another piece which some psychologists think of is that if you are able to understand the directions and think about it, plan that I'm going to do squats here, 3 squats 10 times each, planning, executing the actual action through your brain, that also will help mitigate any cognitive declines that have occurred or that are about to occur as well.
Okay, thank you. It seems like you've kind of given everybody the incentive to do something.
Yeah,
Important.
I hope so.
Do
Do
something.
anything.
Maybe not as much as people would like. Somebody had put in the chat, somebody who would had mentioned that they were not doing as much as they wanted to, but after hearing you talk, that she's now doing like 15 minutes, and
Oh, great.
that's good, and we'll try to do more. So that was incentive too. I think it's like we say, just get moving.
Yeah, just get moving. I just want to make one point that like I think all this research that says like exercise is good, there also there's this unintended effect of like almost shaming, like, oh, I didn't reach the guidelines. This says it's good, but I just can't fit in my day. I want to reiterate that's okay. That's okay. If you can try to do something or that you're aware that you want to do something, I think that's a great start. And then, think about how you want to make these tiny, tiny changes. Like that book said, atomic changes or atomic habits will lead to great results. So doing anything and that you can as a start would be a great benefit.
Okay, thank you.
Yeah.
Tony, I think we're ready for you.
See, can you hear me? Can you see me?
Yes, we can.
Okay, great. All right, very good. I'll see if I can pull up the slides here. All right, first of all, thank you so much, Dr. Wanigatunga. That really was a very enlightening presentation. And I have to admit, while you were talking, I checked my iPhone app for health, and I'm pleased to say that it looks like I'm walking about 100 steps more this year than I did last year per day. So that's good. The bad news is there's room to improve. So I'm definitely inspired to move my body more, and thank you for giving me that encouragement to do so. It's all a step in the right direction and moving away from dementia. So before we conclude, I do have a few announcements for our audience. You will receive an email with key takeaways and a link to the recording in about 3 weeks. And our next webinar will be in the fall. We'd love to have your ideas. So if you want us to find a speaker on a topic, or a speaker who would be great for our webinars, please send me an email to tony.teano, that's spelled T as in Tango, E as in Echo, A as in Alpha, N is in November, O is in Oscar, at jhu.edu. Tony.tiano at jhu.edu. And in case you didn't know, it's worth mentioning that the Alzheimer's Association has a wide variety of programming for people living with dementia and their caregivers. Most notably, they have a 24/7 helpline. That number is 800-272-3900. Again, 800-272-3900. And you can find out a lot more information about their resources at alz.org. Please connect with them when and if you need help and support. If you live in the Baltimore area, you may be interested to know that the Johns Hopkins Alzheimer's Disease Research Center is currently enrolling volunteers in several research studies. Those with or without memory difficulties may be eligible to participate. For more information, call 410-550-2281. Again, that's 410-550-2281, or visit alzresearch.org on the web. A debt of gratitude from the depths of our heart is owed to the following individuals who contribute to Brain Matters. These are the volunteers in this collaborative venture that work year-round to help bring you programming like this. So thank you, each and every one of you. Most importantly, thank you for attending. We do this for you, and we hope you found something interesting and motivating tonight. So thank you again for your interest in our programming. Your brain matters.